between whoever you're seeing, we'll talk about who you may be seeing, and you as the patient. So I think you'll find it applicable to all the settings that you would. Does it matter who you're seeing? No. This is still a one-on-one relationship. So if it's an MD, a DO, a physician's assistant, a nurse practitioner, all of those are people interested in listening to your story and deciding what's the best way to either treat you or figure out what the disease is that needs treatment. Does that make sense? So I guess this is a side event. MDs and DOs in the past had a lot of difference in their training, but in the last 20 or 30 years, they don't. The medical schools are very similar, but more importantly, when you're doing your residency, okay? For instance, at Dell right now, 20% of the physicians in the residency program have a DO degree. And so everybody's getting the same change, and I hope you would agree with me. Thing. And then, of course, they're the physician's assistant. Nurse practitioners go by things like advanced nurse practice nurses or a variety of names that they do. But my message is it's one-on-one about this. We're not here to help you choose a doctor or a health plan. If you want to ask us individually about that, we're up to that. I got really excited when we were putting this together. You talk about contrast. Here's an old senior white male compared to a bright young female physician who comes from a different cultural background, and her area of practice is different from mine. I'm a gastroenterologist, came to Austin back in, when did we come? 1974, ran a full office practice until about 10 years ago, and then have done part-time work since that time, and I still do some charity work and teach. You want to tell us your background briefly?
Well, there you go.
Well, come on. Yeah.
So, I'm Dr. Mota, and I'm a board certified family physician, and I've been practicing family medicine and primary care since 2014. And I come from Venezuela. My family is from there. So I moved in 2004 with my husband, and we made our lives here. Now we have two Austinian boys, 5 and 7 years old, and we love Austin.
Elaborate on that in a moment. I think when you came in, you were given the opportunity. This is a book called Talking with Your Doctor. It encompasses more than just the office visit. It's on the back row and free to take it. It's published actually by the National Institute of Aging. Now, none of you are interested in aging, I know, but the National Institute of Aging. Also in the back, there is a survey having nothing to do with what Estelle and I say. It's from the Area Agency on the Aging, just about senior needs. And they would appreciate if you take it with you and then fill it out and then mail it in, because that's the only way they know what senior needs are, is for people like us to decide what senior needs really are. So that would be the appropriate way of doing that. Okay, can I have the first slide, Vicki? Now you're going to
Tom, your voice is very low.
before you fall back into C.
Who is starting? Who is starting? Me or okay? Perfect.
Okay, you almost got here. That we deluded you into coming. Give me this next paragraph, okay? And then the next paragraph, the next slide. Okay, when I said you've got to do a little bit of work, I'm speaking of the fact that your perspective on answering the question that you all came to learn about comes from who you are, right? If you're the patient, and I'll come back to that in a minute, you're expecting something very specific from the office visit. If you're the family practice doc, she's going to help you understand what her perspective is. Remember that she's interested in your primary problem, but also your general well-being. In other words, she's the captain of the ship, or whoever your primary care doctor is, and will help you manage the problem within the confines of your general health. Agreed?
Agreed.
And then there are those crusty old specialists. We have a special interest in just what you're coming to see us about. But, so if you're coming with belly pain, boy, I'm excited. If you're coming with something in your bones or joints, I don't really care too much. But I've made it sound so simple. But what if you have shortness of breath? Are you going to go to the pulmonary doctor or the heart doctor? You're going to go to your primary care doctor. They will discern which would be the best stop for you. So that's the perspective that I really, let's go back to what you want for a visit there at the very number one. Okay, what do you want from an office visit to your doctor? Just stay where you are. What do you want? Do you want a diagnosis? Most people do. Point with you. Yeah, thank you. No, exactly. And
It's not on. Oh, it's on. Oh, I want to feel that the person I'm going to is known to be very competent and experienced in the field that I need.
right. Okay. Do you want to make sure that they understand your story? I think that's what I hear most from patients a lot is the doctor didn't understand my story or didn't get all that part straight. Okay, what else? Arnie? Okay, why don't you say that so the people on Zoom can hear?
Oh, I like to feel as if the doctor is willing to take the time to listen. Sometimes you go in there, you got 15 minutes and they're already thinking about either the last one or the next one. So what I would really like to feel is if the doctor cared about me particularly and not just getting through that day.
So cared about you and listened well
listened.
enough to understand what, any other things you'd like from an office visit, Mark? Okay, I think that's reasonable. Anything else you want from an office? Erilyn, were you going to add anything?
I oftentimes need clarity because I maybe have heard it before, but I get confused. Like, I have low blood pressure, but now I'm taking high blood pressure medications
Oh, you
because of
did
my
hear it.
heart thing. And so it's like, okay, now why am I doing that?
So clarification of what your diagnosis is
Right.
and what the medicines are being treated here.
Right. And then it's like, well, okay, this is the reason that I can like release that
Mhm.
confusion or that lack of clarity about what I'm supposed to be doing.
Anything else about what you would like to get from the doctor's office? Mike?
I would like, especially primary care physician, I'd like to have an overall game plan for my long-term health as far as suggestions and just overall thorough
Sure, no,
game.
those are valid. So you see, you come with one set of expectations or needs. The primary care physician has what we've already talked about and you'll hear more about, and the specialist is honed in on whatever that specific thing. So you see from the beginning, there's a little bit of tension, but a lot of overlap as to what we want to do with this office visit. Come run with it and tell them how to be how you can be a perfect patient. We're gonna put responsibility before we
We're gonna
stop.
change
We're
the
gonna
slide.
tell you what's important
This slide.
for you to do to improve this, but I just wanted to orient your thinking about that we all come from a slightly different viewpoint.
The one that is community talk. Yeah. Switch to the other file that says community talk.
At the beginning, I totally neglected, and I apologize for not thanking doubly strong Vicky Aycock for being our board person. She is the substitute in every respect, meaning that she's available to do all of it for all of us, even if she just got back from Ireland.
Thank you, Vicky.
So as Dr. McCord said,
Why don't
You
bring
go-
over here so they
you
can
go
see?
to a doctor and you don't have the answers. You don't know what is it that you need. But one thing you know is that you want to feel better. You want to get answers to what is it that is bothering you on the day-to-day basis. And you're going to a highly trained professional in the area of medicine to give you answers, right? So basically, let's go to the next one. Thank you. So somebody mentioned the time. And I wanted to say that what we're gonna say here is ideally what you want to look for. But we understand that the system has some limitations. And, you know, you have to navigate the system as better as you can. But the reality is that currently in the state of affairs in medical care in our country, the time that the doctor gives you depends a lot on how the doctor is reimbursed, okay? So if the doctor depends on reimbursement from insurance, Medicare, private, Medicare Advantage, they are forced to survive based on volume, right? So they have to accommodate everybody in a specific amount of time. They cannot just sit for a long time with each patient because then they wouldn't be able to operate or survive, right? So that's the sad reality of our current medical system. So how many of you have felt like this when you go to the doctor? That is a very common feeling where the patient is kind of, hey, I need help. And the doctor is like, okay, bye. And he's like, come on, I'm here drowning. Have you felt like that? Yeah, I've seen that happen. And I've heard a lot of people complain about that. So let's go to the next one. So who you want to see? As Dr. McCord said, of course, the first requirement is going to a medical professional, right? So you have MDs, DOs, you have nurse practitioners, and physician assistants. Hopefully, when you go to a physician assistant or a nurse practitioner, those professionals are being led and supervised by a MD or DO because, you know, the training is different and they are there to extend the medical doctor or the DO, not necessarily to be independent, okay? Because they don't have the same amount of time and experience or training that a medical doctor has. So, however, whoever is that you talk to, the main requirement is you want a professional that takes away the need to feel pressure to get the most out of only that visit. If you feel pressure to have everything solved in 50 minutes, that's not the right physician. They need to make you feel like they are gonna be there, even though they're not gonna spend 3 hours with you, that they're gonna accompany you over time, okay? That even when you have a appointment that day, they're not going anywhere. They're there, they're gonna check your chart after you leave, they're gonna call you back, they're gonna review your records, they're gonna talk to a specialist, they're gonna get back to you, they're gonna follow up. So continuity of care is key for family physicians and internal medicine, primary care, okay? It is impossible, not realistic, to feel like that primary care doctor is gonna know you very, very well with one visit, okay? So that's the main thing. They need to, you need to feel that they are there for the long run. They're gonna get to know you over time, little by little. They need to, I mean, as much as you can, find somebody that has time for you during that visit, but also outside of the visit, okay? Because a lot of care happens outside of the visit. In the visit, of course, they can do a physical exam and they can check on vitals and they can talk to you also, but you may call for a concern later outside of the visit. If they are not available for you, that's not good. You have to find somebody that has availability outside of the visit. Then you want to find somebody that where you have firsthand communication as much as possible. There are clinics that have so many patients. They have a lot of staff. And so you are calling and talking to several players before the doctor even knows what's happening to you. So that disrupts and fragments the care. So if you pay attention to that and try to find somebody that, or a clinic where you have less people in between, that will be good. Find somebody that has, that understands the importance of the emotional balance in your life, okay? Because regardless of what's happening and regardless what you need, like testing, a specialist, or what is it that you're feeling, if you're stressed, anxious, frustrated, that's gonna make things worse. So personally, I put a lot of emphasis in having the patient manage also from that perspective to make sure we're talking about those emotions and as much as possible to reassure them and give them a sense of relief. Like Erin said, they want to put that pressure, release it, so it's not on your head, okay? So your doctor should have that in mind as well. And of course, you want a doctor that has the time and the availability to talk to the ER if you end up in the ER, or to other specialists that they can communicate well. So again, part of the fragmentation of care, you want to have all the players communicating, okay? Let's see. This is another funny slide. Just so you can laugh a little bit. Doctor, my back hurts when I wake up in the morning. Wake up in the afternoon then. That's a funny slide. Hopefully your doctors don't say that. Go to the next slide, please. So should I make a list? Everybody here has made a list and take it with you to the doctor. Okay. It is important to know what you should put in that list. If you say, okay, this is my list. Headache. I was short of breath. I cannot exercise because my knee hurts or whatever. And you do 10 things. The doctor needs a little bit more information on each of those problems. So you're not going to remember all the details in that visit, even if you have a list. So what I would recommend is you want to have a diary. You want to have a notebook for your symptoms. And you want to work on that before the visit. So if you have a headache, what the doctor is going to ask you is, when does that happen? How does it feel? How long it lasts? Did you take anything? Was there any other symptom associated with that, right? Because all that information is needed for us to really make up something, like to have a sense of what's happening, right? So again, do not just write like short bullet things, work on all the characteristics you can think of before. So then if you see that you have 5 pages and you have an appointment, a 15-minute appointment, of course, it's not going to be realistic. So you probably are going to be geared to pick the most important, right? And bring that, but with as much information as you can so the doctor knows a little bit better what's happening. And then, okay, the next one. The list keeps expanding. You're talking to the doctor. Okay, the next one. Now, you do not want quick fixes. Okay, if you guys go to the office and you want a quick, like, I just want the doctor to tell me simple what it is, fix it. There's some things that could have that type of reaction from your doctor. That's great. But you don't necessarily want a quick fix. You want the doctor to really dig deep, make sure that they consider as much areas as possible. So then the plan is truly effective and not just like a Band-Aid. So it is important to understand that you may not have an answer in that appointment or by the end of the appointment. Because after we get all that information, we're going to do a full physical exam, right? Or like at least a targeted, well done exam to the area of concern. And that's going to give us more information. But then we might need testing, and the testing may take a few days to get back, or imaging, right? We may want to, after all that, to do research on our own and look for more things before we talk back to you and give you a plan. We may need to talk to colleagues, right? So better than having a quick answer in the moment. Again, there are some things that you may get that, but you want a good plan. And it's not good to have the expectation of having everything done right then and there. You want the doctor to have the time and invest enough time to give you a proper sound plan that really helps. So do not build unreasonable expectations because that causes anxiety. So trust your doctor that if you really think that doctor is able and competent, they're gonna come back with something that applies to the best fits you, and not just rush to something because they are anxious, that you're anxious, that you want something fast. Okay, good. Next one. So what do I bring to the visit? Bring your medications. Everybody says that, and I rarely see patients bringing the bag of medications. We want that. We want the bag of medication. It is very hard for us to keep track of things sometimes, especially if you see several doctors and everybody's adjusting things. We might not have the most up-to-date list. Bring your bag with your bottles and the instructions. Have a machine at home to check your vital signs. And that goes also on the notebook, on the diary. Whenever you have a symptom, check your vitals. Even if you don't think it has anything to do with it. It's more information for the doctor. That one blood pressure pulse in the visit is not the most accurate. The most accurate are the ones that you have in your regular environment doing your own things, right? So bring your blood pressure logs and your heart rate, whatever the machine tells you, just to write it down on your diary and bring it with you to the visit. And then, of course, the diary of the activities and symptoms that we talked before. Next. Oh, sorry. Any questions so far? Aha, yes. He needs the mic. Oh, okay. Oh. The blood pressure and the pulse? Yeah. It's a good idea always. Yeah. Yeah, I think the problem is the people at home. Mhm. Yes. Right. What I meant is, even though you have a portal with information, that information comes from you at some point. So every time you have a visit, you need to make sure you update the doctor so that portal is up to date. Because a lot of times I've seen portals that have the wrong list of medications, and the patient doesn't check the portal, and the patient doesn't talk to the doctor, and the doctor doesn't ask, and it's just a mess, right? So if you bring your bag, even if it's the same that they have in the portal, it's another check, another filter to make sure nothing is lost. And then back to what you said, she was asking about the equipment to have at home. And I would recommend to have a basic blood pressure electric, the ones that use batteries, blood pressure machine. It gives you the blood pressure and the pulse. And you can find it in any pharmacy. And it's usually affordable. Just have that at home. Make a habit of checking your blood pressure when you don't feel well and write it down for the doctor, for the appointment. Any other questions while she works on the slide? Yes, yes. And should I repeat the two questions that they did or? Uh-huh. So Erilyn was saying that portals sometimes are hard to navigate for patients. And that's very true. The portals came to the picture because we have electronic medical system, right? A lot of patients feel very comfortable navigating that, but others don't. So we shouldn't rely on the fact that, well, there's a portal. We should accommodate to each patient at their level, at their capacity, because the goal is to have accurate information. So if I have to talk on the phone with the patient outside of the visit, you have a list. I'm gonna forget about the portal with that patient. I just need the information I need and I'm gonna work with them. So we're going to the next slide. Yeah. Oh, okay, okay. Right, I'm saying it too. So maybe you can share it as a document, but if we can, I'm reading everything that is there, so I don't think they're missed. I'm going to slide 9, I believe, or 10. Let's go one more. Uh-oh. There you go. Let's go down. We already covered that one. Okay, who to ask? Oh, well, that's another joke. Doctor, my child swallowed a roll of film. What should I do? Let's wait and see if anything develops. So let's go to slide 11. Who to ask question? Okay, this is very, very important. And I want to help you with this one. I have patients that see specialists besides me. And like we said, my job is to keep a wide vision of what is happening, right? So then I can manage the whole picture for the patient. But a lot of patients think, well, I have a cardiologist and I felt some palpitations. I'm gonna call the cardiologist. Or I have stomachache and I have Dr. McHorse as my gastroenterologist. I'm gonna call him. What I always tell my patients is this: we have the specialists as resources for us, okay? The specialist, like Dr. McHorse said, is going to focus on their area of expertise. What you want for a specialist is a capable specialist, like somebody very knowledgeable about that specific area. I tell them, you don't even really need that doctor to have a lot of bedside manners. I want a competent specialist. I don't care if they are dry and short. I want them to do their job the best they can, right? They're gonna send me a note, detailed note, okay? My job is to see, because I'm a physician, so I understand what they're doing, even though I don't do it, I should understand. And I can spend the time to talk to you about what they are doing, right? So that helps a lot, because my patients sometimes get frustrated if they don't get the answer from the specialist and they don't think I can give it, or they don't think I can help them, right? So always ask the primary care physician. They are there to help you navigate all that. So a doctor, a primary care doctor, your PCP, how we call it, right? Your PCP that is able, available, affordable, and affable. Those are the 4 A's in my philosophy of what you need, are as important as a skillful surgeon that is gonna cut something in your body, okay? So make sure you communicate with your PCP about everything, okay? If, let's go, this picture right here shows how we work together, right? It's like we try to balance things out. We're working together, trying to kind of help each other and keep things going, okay? So let's go here. And then this one. So what happens if you go to the doctor and the doctor says, you know what? I don't know. Would you get scared? Okay, so I wanted to tell you this. A lot of times we don't know in a moment. That doesn't mean we're not capable. Remember, your medical professionals study for a long time to know as much as they can, and we try our best to keep updating ourselves and studying always. Saying I don't know doesn't necessarily mean they're not capable. Saying I don't know means I need more information at this time. But believe me, your PCP and your specialists are highly trained professionals, and they are going to find an answer. They may not know in the moment, but they're going to work on it. So that, again, is more important than having all the answers in that second from a person. We're human too. There you go. Yes.
Nice slide there. If there's some redundancy here, I'll try to run over it, but when we're redundant, that really means that we think it's very important. I used to have a professor who said, if you say it 3 times, it's true. Well, she said it once, I've said it a second time, and whatever. Back to the point of portals, which are important in this world, but ask Kay McCourse the last time she looked on a portal and knew how to look on a portal. Actually, Tom McCourse is not much better. But seriously, they're there to be helpful, but if they're not helpful to you, then that's one of the things you need to bring up. Go to number 4, please. There we go. Now, to the next, to number 5. Am I on? Can you hear me? Yeah. There we go. Okay.
Tom, we can hear you fine, but we can't see you. We can't see
Preparing
anything
for a
on the
specialist
screen.
visit. The point's been strongly made about your medications. It would actually be helpful for you to know what the medications are for. Surprise. But there are 3 white pills and, well, I'm getting treated for diabetes and hypertension, but I don't know which one it is. So if the doctor says, we'll take 1 extra of your hypertension pill, you don't even know which it is. Aha, my favorite topic. Always ask your physician to put the indications for use on the bottle. 1 daily for acid, 1 twice a day for blood pressure. And that's important. And if not, you can enter your own. But the list of medications they're used. Back to the portal, or it's not even the portal, but remember when you're going to see a specialist, many of them will send you an email saying, please fill out your health history. So that is important in your preparation. I'm a total believer in dragging somebody to the office visit with you.
Mm.
Okay? Why? Well, 1, we're old and deaf. Number 2, as Erilyn has said, we don't always understand what's said. So I just, I know sometimes you're a little hesitant to say, well, so-and-so doesn't need to know that about me. But having said all that, if you get nothing out of this, take an advocate with you to at least listen. I mean, even Stan does that, right? You're supposed to say yes. Anyway, seriously, identify an advocate for almost any visit that you make. It is important to make sure those records have gotten here. In the electronic age, that ought to happen, but it doesn't. Don't call the specialist to say, do you have my records? Waste of your effort. They're flopping around doing it. You need to call the receptionist at your at whatever the records you're seeking, usually a primary care, but also the previous orthopedist who saw you, whatever, and just say, have you sent them? And do that more than an hour before your visit. Okay, that's important. Now, back to reinforcing what's already been said. I put there your notes. You need to write down your dominant symptom. I've got belly pain, or my back hurts only when but the doctor will want to know. See, you're going to give the doctor spontaneous information, and then he or she will ask you some of the details that they may need to know. But please be relative direct. I'm being very blunt. This is a confession session. To say my back started hurting when I lifted something out of the back of my car is correct. To say, well, I was on the way to the grocery store and I got too many groceries and they were too heavy. And then when I was getting them out of the car, they made my back hurt. We don't need to know that. No offense to your storytelling, but think what's important. My favorite story, well, it is my favorite story. I once asked a patient, do you have any pain in your stomach? No, doctor, but it sure does hurt right here. And I say that, and that's the doctor's responsibility to try to figure out the right vocabulary for that particular patient. So, and the other thing to put on your information, both your notes and your dominant symptoms, if I'm an orthopedist, I want to know what happens to your pain in your leg when you get up and walk. If I'm a gastroenterologist, I don't care what happens to your abdominal pain when you get up and walk, but I want to know what happens when you eat or when you poop or something. In other words, when there's some action. So think about as you're doing, and you've all got good enough brains to be able to do that. And other things like what makes it better makes it worse. Putting an ice pack on it helps. Taking an antacid helps, those things. So it's really important to figure out your dominant symptoms, as she said, but also the things that affect it, and not to go into every little detail. Let me give you a hint. If you ever go to the gastroenterologist, everybody who has any symptom has bloating and gas. So that's not relevant, okay? That goes with almost every gastrointestinal symptom. Again, these are facts. You don't go into the doctor and say, Dr. Mota, Dr. McCourt said, I said to do this, okay? That's off base. Okay, let's go to the next. Okay, so let's go specifically to the visit. Now, we hope that you all don't end up in a wheelchair when you're doing that, but let's go on to the next slide, please, Vicki. Okay. As soon as you read that first line, you're going to say, but the doctor's always late. Why should I be on time? The answer is if you're the first, second, or third patient of the day and you're 15 minutes late, plus, let's be honest, it takes 3 minutes longer for a senior citizen to walk back to the examining room and climb on than it does for somebody who's 25 years old. So you need to give them a running start. So try to be on time. And of course, as has already been said, please bring your medicines and your notes. Make sense? I'm a big bird, just reinforcing the advocate coming into sitting in the waiting room. How much good is that going to do? None. Okay. So please be comfortable with that person. Describe your symptoms, doctor. This is where it hurts. This is how long it's been going on. This is what makes it better or worse. It's there all the time. It's there once a week. How long does it last? Does it last, as I'm fond of asking patients, does it last 2 minutes or 2 hours? And that's a huge important answer in terms of me trying to figure out what the problem is. So describe your symptoms, and you have to have some concept of prior treatment. That pill I took that the doctor said was going to do wonders didn't work. And then this doctor will say, well, do you take it as he prescribed it or just as you decide to take it? That's actually one of my chronic problems. But seriously, know the results of prior treatment. You know, I took Celebrex and it didn't help. You don't have to elaborate. It just didn't help. Okay. The last one, it's okay to say, I don't quite understand. Would you please help me with this? Or more importantly, I can't hear what you just said, doctor. Would you please raise your voice or repeat it or do whatever it takes? So I hope those are helpful things about having the advocate there. Be as specific in your symptoms and we're interested in the roundabout backstory. It's important if you're telling the story to your neighbor. It's not necessarily important to that aforementioned 15-minute office visit. Next slide, please. Next one. Yeah, sorry, I didn't get stuck in. Okay. Before you walk out of the door, you've already told me what you wanted for an office visit, right? Most of you could verbalize what you wanted for an office visit. Do you understand? Run through your brain. Do you understand that my major problem is high blood pressure or low blood pressure or heart disease? Any additional testing needed? If you don't mentally go through your mind, or maybe even write it down on your piece of paper, make sure I have answered these questions before I leave. So additional testing needed. I think it's really important to ask what you expect. Here, this is Dr. McCourse's magic stomach pill, but it'll take 3 weeks to start working. Okay? So I'm not going to stop it after a week. Okay? So please understand that you need to ask what the expectations are, the time for improvement, expected results. And it's always, particularly if you have a pain that can really get bad, ask the doctor, since you're there for his specialty care, what do you do if it suddenly gets worse? Do I just go off to the ER without telling anybody? Do I call your office and wait for a day and a half for a call back to say go to the ER? Understand my point. I think that, so if it suddenly worsens, you're not expecting to do with your magic new treatment. But if you don't have answers to that, you're not treating it. And that's why having the advocate there is reasonable to write down that information. And if they're giving you some pill that you've never heard of, don't say, I want all the side effects, because that's not realistic and you won't remember it. But if 15% of the people on this medicine get dizziness, then the doctor ought to tell you that. But sometimes you have to prompt the physician to do that, no matter which specialty you're in. So common, that's why I use the word common, not just side effects.
Don't leave confused.
Right.
Don't leave that visit confused.
Right.
You need to make sure you're clear.
So those are the things that I hope we have said, several things that this is how you need to think about, hey, what I want from this office visit. Second, depending on who you see, some of the specifics that hopefully you will have written down some of these or no. So let's open it, start with you to go ahead to the next slide, Vicki. The bottom, next to the bottom. Anyway, why don't you go back to just showing us live, get rid of the slides. Questions that we have put you to sleep already and you forgot about? And if you're on Zoom, you can just raise your hand and Vicki most of the time can see you. Sue?
I have a question about the bag of medicine to bring with me. I keep a
About the what? I'm sorry.
bag of medicine or medicines. I keep a running list of my medicines with when to take them. And I keep on my computer and I update it and all my the supplements I have. Do I really need to bring the bottle?
If you know you're very good about details and you transcribe everything in that label to your list, that's fine. I've had discovered people are confused and whatever is in the label on the bottle may not be what the patient is doing, right? So again, that's why I want to know what's in the label, because that's what they got from the pharmacy. And not everybody would maybe have, right? So, again, it depends on the patient. If I see that there is confusion or there is a lack of ability to transfer things from the label in the pharmacy to a list, I may just tell them, just bring the bottle. I want the bottles. Don't worry about making a list. Bring the bottle.
Yeah, not everybody is good about. Let me throw in one word and then we'll have Mark's question, whoever. Okay, sure. Don't be offended when the doctor asks you, have you thought about killing yourself lately?
All right.
And I say that because Medicare now requires an inquiry about depression, not suicide, but depression. So those are routine questions that are supposed to be asked, particularly in any primary care office, about level of depression. So don't be offended that, hey, do I look that bad? But mental health questions are now, in essence, to meet quality measures for primary care you need to do. Who's on? Go ahead. Make sure you're off mute.
Marion, talk.
Oh, Miriam, we're
Okay.
listening. Do you have a question?
Yes, I do. I have a few questions. The first one is, how do I get that booklet that you showed at the beginning? That's one question.
We'll mail that to you if you promise not to change addresses.
Okay. The second question is, when you say bring medications, does that also mean to bring the supplements you're taking?
Vitamins.
Yes. Bring
Okay.
everything that you're putting in your mouth as far as pills, especially to your, well, to any physician, but I want to make sure I know what things can interact with the prescription medication. And so it is important to know supplements as well.
Okay, and then the last question I have is about the doctor say prescribes medicine X for something I had no symptoms for and I didn't know I had. That just happened recently. And when the test results come back, it's a nurse who calls me to tell me the results and what medicine the doctor wants me to take. I really want to know, are there any lifestyle things I can do instead of taking that medicine? Is there anything I can do in the way of exercise, supplements, dietary? I want to know all that. How do I find that out?
I would recommend always when you are talking to a representative from your doctor, you need to express your question because that person is trained to bring that question back to the doctor. So initially, they're trying to get the results to you, but they're also trained to get your questions back. So just ask them what you need to know, like, hey, I mean, you're giving me a statin for cholesterol and you're telling me my cholesterol is normal. Why would I take this? Should I just quit and eat a better diet? Then they need to write that down, get it back to the doctor, and the doctor needs to address that question. And if they're not able to address it in a phone call, they're gonna say, she needs an appointment, get her here in the office, I'm gonna talk to her about it.
And we recognize that we're saying, do this to get communication. It's intimidating in some offices. So I think before you walk out, it is important to understand the first visit with the specialist or primary care. If I need to communicate information, do I call the nurse? Do I email you? What is your preferred method of communication? And if you're capable of emailing, that often is nowadays a better way because the nurse is frantically running around. But so ask the question, how do I communicate with you on your first visit with whoever we're talking about? Because that part's important. Back to your original question, Marion, about taking a pill that you're not, that's again, if you're not thinking of it at the time it's prescribed, then that's the kind of thing, email or even snail mail. Send them a note and saying, what in the devil is this for and what are my alternatives? But that takes a fair amount of advocacy and we acknowledge that fact.
Right.
Mark, did you have a question?
Just a comment. The other thing that I've encountered is the office staff who's putting you in the room and maybe taking the initial blood pressure and all that can not be very competent. And so I think you need to watch out for that and also relay that to the doctor or the doctor's staff and be patient. The other thing, the pharmacies have really messed up my medication. And on 3 different occasions, one day on the same medication. So you're really going to have to make sure that your pharmacy knows what they're doing. I had to read them the prescription on my bottle to finally get it right and count the medication. So that's kind of scary, but things are going awfully fast these days and we have to be assertive but calm about getting things straightened out.
Right, that is also why in most clinics, they follow a standard process of printing a summary for the patient. The summary should have the complaint they brought, the list of medications that they are living with, and what pharmacy they're sending it to, and plan of care, right? So that list should be for you to confirm that the pharmacy is doing their job correctly.
Well, and that's another, back to the question of bringing your pill bottle. Yes, we're getting pretty far out down to the 1 or 2% chance. But if I look at the bottle and it says take 7 times a day, and I only said to take it once a day. So there are a lot of reasons for actually bringing the bottles, as much as a nuisance that is. Back to the question about supplements. There's more than one supplement. I used to be, being a gastroenterologist, that includes being a liver doctor. I've certainly over the years seen a moderate number of patients who their abnormal liver tests were because of supplements, not from a side effect of medicine. And there are a lot of things that cause liver disease. Of course, the most obvious everybody thinks of is alcohol, but really medication can do that, and particularly supplements. So that's both why I guess we're going to make you bring all your pills.
Dr. McCourse,
Yes,
this is
go ahead.
Carol.
Go ahead.
Yeah. A few years ago, I think you saved my life when the doctor ordered a wrong prescription and you told me not to take it because I read it to you over the phone and you said, absolutely do not take it. And I know in another case, a pharmacist saved my mother's life in Houston when the prescription was entered wrong. So I just think and that happened when I saw her after surgery. She's allergic to penicillin all her life. And this was a young intern, and the medicine that he'd prescribed had penicillin in it. And if I hadn't asked him, did you know my mom's allergic to penicillin? I really wonder what would have happened. So I don't know how we take at that. We just have to be careful on both sides, is what I think.
Well, you do, and we can't make excuse to err as human because it's your body. But the fact that doctors don't write their prescriptions out anymore and send them in typed is a major step forward in the care of the patients of the thing. Obviously, there are so many jokes about doctors' writings, but before we got to electronic health records, one of the few saving graces of electronic health records is you do put things in a typed format rather than going relying on the doctor's office. Pat?
Need some some clarification about nurse practitioner versus physician assistant, or perhaps even just the assistant in the primary cares or in a doctor's office. And should we ask for one or the other if they're representing the physician?
Right. Well, that's a valid question, and I'll give you my view, and certainly Estella. Number one is a physician's assistant and a nurse practitioner are equivalents. Okay, they've gotten there a different way, but the final common pathway is the same. Meaning they've had basic training, and then if they're in a gastroenterologist's office, they've had additional training in how to do gastroenterology stuff, or if they're in family practice office. So number one is to say, is those two are the same. I've already spoken about, I don't have any preference between DO and MD. Who comes in and gives you their advice and stuff is what you have to be comfortable with. In other words, you're not going to take diagnostic information from a medical assistant. I think all of you are probably aware that when I started practice, almost every doctor's nurse was an RN. That's a rare bird these days. In most practices, you'll have a medical assistant, and they do a good job. It's not to downplay, but obviously their level of training is different. So I think, I hope I've made the point about the equality of stuff. In terms of, that's a decision you make in saying, I want an appointment with Dr. Smith, and they'll say, Dr. Smith can see you in 3 weeks, and his nurse practitioner can see you tomorrow. They are supervised, and in a perfect world, that's good. So there's certainly nothing wrong, in my opinion, of seeing the nurse practitioner. Back to that original question that Estella made, or Sue or somebody else said, are you comfortable with that? And if you've been there before, you might be that. If you haven't been there before, of course, it's not thing, but feel comfortable with those, because the nurse practitioner, if she or he has any questions, it's okay to say, have you discussed that with Dr. Smith? How would you answer her question?
I would say, agree as far as like medical assistants are just helping the doctor gather information in the office. They're not really the person that you want to ask a medical question. So every time you talk to a medical assistant, it's understood that that medical assistant needs to relay everything exactly the same to the doctor. And maybe they can call you back with that answer, right? But they are not gonna, they shouldn't originate recommendations to you. Now with the extenders, I would recommend for you to make sure you see the doctor every once in a while. I wouldn't recommend for you to only see a PA or nurse practitioner for years without ever meeting with an MD or DO. And the reason is, ideally, those professionals should be supervised and should have the time to discuss the cases with the the doctor. But that doesn't always happen. It's sad, and it's not what needs to happen, but that's the reality of the system, because it's an overcrowded system where everybody's trying to survive, to see a lot of patients. And so I've seen practices where those professionals are basically working independently, even though they have a license under their license, over the license. So I would go to a place where there is a medical doctor in-house and maybe alternate the visits. Like, okay, well, I saw the nurse practitioner the last 2 times. I'm gonna make sure the next appointment I see Dr. Mota or Dr. Smith or whoever.
Does that clarify your question, Pat? Anybody else on Zoom? We're delighted to see all of you on Zoom, and again, thank you for coming. We'll be available after if you have some question you didn't want to verbalize to the whole group. But Vicki, Bob, Art, thank you for making it all happen.